This is JAPI, and welcome to JAPI Podcasts.
Hello friends, I am Dr. Ashutosh Chaturvedi, Associate Professor from Jaipur, Rajasthan. Welcome to the JAPI podcast of the December 2024 issue of JAPI, Volume 72, Issue 12. This issue of JAPI has some really interesting articles that includes 8 original articles, 3 review articles, 1 update article, 5 unique case reports, 2 pictorial CMEs, and 2 letters of correspondence. Let's discuss these in detail. The first original article is by Arka Parva Dasgupta et al. That is an epidemiological study on magnitude of selected components of metabolic syndrome and its risk factors among first-year MBBS students. This was a cross-sectional, epidemiological, institutional-based study conducted at the Medical College in Eastern India. The study aimed to assess the demographic, physical, and biochemical risk factors for metabolic syndrome among first-year medical students using a pre-designed, pre-tested, semi-structured questionnaire. The results of the study were like this, that it included 150 first-year medical undergraduate students with a mean age of 18.5 plus minus 0.4 years, comprising with 68% of males. Among students who were smokers, consumed alcohol, and had excessive junk food, salt, and red meat, the risk of metabolic syndrome was found to be significantly greater with p-value of less than 0.00001. The logistic regression revealed that history of smoking and history of alcohol intake were significantly associated with greater odds of metabolic syndrome. The study concluded that in young adults, the risk of premature cardiovascular disease can be reduced by focusing on the early identification and prevention of risk factors for metabolic syndrome. Context-specific, cost-effective, and feasible interventions to reduce identified risk factors are the need of the hour. Moving on to the next original article, that is titled as the comparison of basal core promoter region mutation and pre-core mutation among the mono-infected hepatitis B virus and co-infected hepatitis B virus with HIV patients by Mandira Chakrabarti et al. The hepatitis B virus, as we all know, has a partially double-stranded circular DNA that replicates through reverse transcription, producing an intermediate RNA. This replication process has a high chance of error, leading to several mutations in the genome. According to several studies conducted worldwide, the classical basal core promoter double mutation, that is A to T at nucleotide 1762 and G2A at nucleotide 1764 in the basal core promoter region and the mutation in the pre-core region, that is G2A at nucleotide 1896 of HBV DNA, have a strong correlation with advanced liver disease. The present study aims to compare the role of basal core promoter and pre-core mutations among two groups of patients, that is mono-infected HBV, acute and chronic, and co-infected HBV and HIV patients. The methodology used for the study was 30 cases from each group of mono-infected, acute 15 and chronic 15, and co-infected patients were subjected to basal core protein and pre-core mutation identification by the PCR and confirmed by sequencing. The prevalence of basal core protein and pre-core mutations between the two groups was then compared statistically. The basal core protein mutation among chronic HBV and HBV HIV co-infected patients was 66.67% and 19.23% respectively, while the pre-core mutation among chronic HBV and HBV HIV patients was 8.34 and 23.07% respectively. Both mutations were higher among hepatitis B E antigen, that is HBe antigen negative subjects. HBV D type was the major genotype among the basal core protein and pre-core mutant subjects. The study concluded in this study had a higher percentage of HBe antigen negativity, low DNA levels, and mildly elevated ALT levels mimicking inactive carriers. Basal core protein mutants have a strong association with chronic liver diseases, so identifying chronic inactive HBV patients harboring the basal core protein mutant is necessary, and they require a close follow-up regimen. The next article is an interesting survey titled DC survey, that is the use of generic DPP4 inhibitor with SGLT2 inhibitor fixed dose combination in Indian patients by Bharat Sabu et al. In India, various cost-effective generic fixed-dose combinations of DPP4 inhibitors with SGLT2 inhibitors are available for the management of type 2 diabetes. Generic FDCs commonly available in India at the time of survey were vildagliptin-dapagliflozin, sitagliptin-dapagliflozin, and linagliptin-dapagliflozin combinations. However, there is very little evidence available regarding the clinical practice nuances regarding the use of these FDCs in Indian settings. Hence, Bharat Sabu et al. Designed and conducted a knowledge, attitude, and practice survey to study the attitude and practice of Indian physicians with regard to patient population and placement of generic DPP4 inhibitor SGLT2 inhibitor fixed dose combinations. They designed a CAP survey questionnaire with 6 key questions to decipher clinical practice perspectives relevant to the uses of DPP4 inhibitors and SGLT2 inhibitors fixed dose combinations. Questions pertain to the clinical practice burden of newly diagnosed treatment naive patients presenting with high baseline HbA1c of more than 8% and patients presenting in clinic with HbA1c of more than 8.5% despite being on monotherapy with metformin. Questions also pertain to the clinical practice of these FDCs, preferred FDC combinations, and the effect of FDC on SGLT2 inhibitor related genitourinary tract infections. The survey was conducted over 4 days in November 2023 at an Indian Medical Congress. In total, 185 practicing doctors from different states of India completed the survey. About 48% of respondents reported that in their clinical practice, more than 40% of their newly diagnosed treatment naive patients present with a baseline HbA1c of more than 8%. Also, 52% of physicians reported that in their practice settings, more than 40% of patients present with HbA1c of more than 8.5% despite metformin monotherapy. 36.2% of respondents preferred sita-dapa as their fixed dose combination of choice. 15% of them preferred linagliptin and dapagliflozin combination, and only 9.7% of them preferred vildagliptin and dapagliflozin combination. So current guidelines recommend initiating dual combination therapy when the target HbA1c is more than 1.5% compared to baseline HbA1c of 6. This correlates with the findings of this survey, with respondents placing this combination for treatment-naive patients with HbA1c more than 8% or those uncontrolled on metformin monotherapy with HbA1c of more than 8.5%. 85% of physicians clinically noted a reduction in SGLT2 inhibitor associated genitourinary tract infections with the use of these DPP4 inhibitor and SGLT2 inhibitor fixed dose combinations or concomitant administration of both agents. The study concluded that generic DPP4 inhibitor, SGLT2 inhibitor FDCs are preferred in treatment-naive patients with HbA1c of more than 8% and those with HbA1c of more than 8.5% despite being on metformin monotherapy. The FDCs are also prescribed for the extra glycemic benefits that they also confer. The next origin articles which we will discuss is by Spandan Biswas et al. It's a cross-sectional study with peak inspiratory flow rate as a prerequisite for prescription of inhaler devices. The objective of the study was correlation between PIFR and the suitability of prescribed inhaler devices in a cohort of obstructive airway disease patients. It's a cross-sectional study of 150 patients including 101 with COPD, 44 with asthma, 5 with overlap from a tertiary care hospital based on GOLD and GINA guidelines. PIFR categorized into 4 groups: less than 30, 31 to 60, 61 to 90, and more than 90 liter per minute. Analysis included demographics, smoking or biomass exposure, MMRC pre and post treatment, and device suitability based on PIFR. The mean age of participants was 53.35 years and male to female ratio of 3:2. Device usage was distributed as 54% using DPI, 33.34% using powdered MDI, and others using spacers or nebulization. Smoking and biomass exposure was prevalent in 63.3% of participants. 52.67% of patients were prescribed an unsuitable device for their PIFR. In the study, smoking and biomass exposure correlated with lower PIFR. It was found that only 43% of asthma patients had adequate control. Symptom relief was partially achieved in some patients despite wrong devices. Thus, PIFR, that is peak inspiratory flow rate, should guide inhaler prescription to ensure suitability and effectiveness. Regular PIFR assessment should be incorporated into routine practice, and education on proper inhaler techniques is vital for improving outcomes. In conclusion, a significant number of patients use unsuitable inhalers due to a lack of PIFR consideration. Incorporating the PIFR measurements and tailored device prescriptions can enhance symptom control and quality of life. The next original article is by Varun Dheer et al. By conventional synthetic disease modifying drugs remain the mainstay of therapy for rheumatoid arthritis in India. This article tells us about the limited data on the real world utilization of disease modifying anti rheumatic drugs in Indian patients with rheumatoid arthritis. This was a cross sectional study of a multi centric observational cohort of 4,061 rheumatoid arthritis patients at 6 centers in India. The data was electronically captured. There was a female preponderance with an average age 51 years. Rheumatoid factor or anti-CCP were positive in 79 and 77% respectively. Data on DMARDs were available for 3,550 rheumatoid arthritis patients. Conventional synthetic DMARDs alone were being used in 3,289, that is 93% of patients. Targeted synthetic DMARDs in 203, that is only 6% of patients, and biological DMARDs in 67, that is only 2% of patients. The most common prescriptions were combination of methotrexate and hydroxychloroquine in 22% of patients. Methotrexate monotherapy was found in 17% of patients, and a combination of methotrexate and leflunomide in 16% of patients. Overall, the most common DMARD prescribed as monotherapy or in combination was methotrexate in about 86% of patients, followed by hydroxychloroquine in 52% and leflunomide in 37% of patients. The conventional synthetic DMARDs remain the mainstay in the treatment of Indian patients with rheumatoid arthritis, as concluded in this study, with the majority being treated with methotrexate alone or in combination with other DMARDs. Moving on to our next article, that is by Shaukat A. Jargar et al. The title of the article is Proposed Algorithm for the Diagnosis and Management of Functional Dyspepsia in India. We all know that disorders of gut-brain interaction, formerly known as functional bowel disorders, encompass a diverse array of conditions and symptoms that may manifest in different parts of the GIT. Some of the most prevalent disorders of gut-brain interaction include functional dyspepsia, irritable bowel syndrome, functional constipation, functional diarrhea, and functional bloating and distension. Around 80% of patients with dyspepsia have no identifiable organic cause and are labeled as functional dyspepsia. Globally, functional dyspepsia prevalence ranges from 11 to 30%. In India, physicians encounter 20 to 40% of patients with functional dyspepsia, with variations attributed to diagnostic criteria and reasons. However, Indian clinical guidelines for functional dyspepsia are currently lacking. 50 gastroenterologists participated in focus group discussions to create an India-specific algorithm for the diagnosis and management of functional dyspepsia. After several national and regional discussions among the group of gastroenterologists across India, an algorithm was finalized for careful and thorough clinical evaluation of patients presenting with these chronic dyspeptic symptoms. This guidance document highlights the role of endoscopic evaluation and Helicobacter pylori infection in the diagnosis of functional dyspepsia, along with the role of proton pump inhibitors, that is PPIs, and prokinetics in its treatment. The experts also reviewed the use of several prokinetics and provided their views on the choice of drugs for varied clinical presentations of functional dyspepsia. Among prokinetics, the experts believe that itopride was the preferred and relatively safer option for the treatment of functional dyspepsia. Moving on with our next article, that is by Nikita Sahai et al. Entitled as To Establish the Utility of Neck Circumference as a Novel and Simple Risk Marker for Detection of Metabolic Syndrome and Cardiometabolic Risk Factors in Indians. It's an interesting article because we know that metabolic syndrome, which is a cluster of conditions increasing the risk of cardiovascular disease and type 2 diabetes, is particularly prevalent in the Asian population. Traditional markers like waist circumference, waist hip ratio, and body mass index have been widely used to assess obesity and for metabolic syndrome. However, these measures may not capture regional fat deposits such as neck fat, which plays a significant role in conditions like obstructive sleep apnea. Research highlights neck circumference as a novel, practical marker for metabolic syndrome, correlating with lipid profiles, blood sugar levels, and cardiometabolic risk factors. A cross-sectional study conducted at Kasturba Medical College explored the utility of neck circumference as a novel marker for metabolic syndrome and obstructive sleep apnea in 183 participants aged between 30 to 60 years. The study revealed that the mean neck circumference was 38.4 plus minus 6.60 centimeter in men and 33.9 plus minus 2.40 centimeter in women, with for metabolic syndrome diagnosed in 17.6% of men and 12.7% of women. The sleep apnea prevalence was 33.1% in men and 29.2% in women. Neck circumference showed significant correlations with multiple cardiometabolic parameters, including systolic blood pressure, fasting blood glucose, and triglycerides. It also negatively correlated with HDL cholesterol in both genders with p-value of less than 0.05. Additionally, neck circumference had a significant positive association with sleep duration, and individuals with neck circumference more than 35 centimeters exhibited poorer sleep quality with p-value of less than 0.01. Compared to traditional markers like waist circumference and waist hip ratio, neck circumference emerged as a practical, reliable alternative for cardiometabolic risk assessment due to its robustness against external factors like respiratory movement and clothing. The study thus concluded that the importance of ethnicity-specific neck circumference cutoffs and their potential use as an additional or alternative diagnostic tool to established anthropometric markers in detecting metabolic syndrome and related risks. Moving on with our next article, that is titled as a study correlating the effects of subclinical hypothyroidism on the known modifiable risk factors of coronary artery disease in Indian adults by Sujoy Roy Chaudhary et al. The leading aims and objectives of the study were to establish a correlation between the presence of modifiable risk factors of ischemic heart disease in subjects with subclinical hypothyroidism. Number two, to quantify the economic markers of ischemic heart disease in patients with subclinical hypothyroidism. The methodology used was that the study was carried out from March 2020 to February 2021. The study variables included history, physical examination, clinical examination, and investigations. Coming to results, of the total 80 subjects enrolled in this study, 54 were females and 26 were males. In the study sample, the mean age was 47.8 years. Different variables were analyzed and the values obtained were recorded for statistical analysis. According to this study, there is a positive correlation between established coronary artery disease risk factors such as hypertension, abnormal lipid profiles, and elevated body mass index and subclinical hypothyroidism. We also noted a strong correlation between subclinical hypothyroidism and elevated levels of uric acid, fasting blood sugar, postprandial glucose test, and HbA1c. As a result, early detection and management of subclinical hypothyroidism may have cardiac preventive benefits. After the original studies, now we move on to the first review article in this issue, that is on current update on promising new anti-Alzheimer's drugs in different phases of clinical development. Where exactly are we lacking? The review article is from Pramod Kumar Sharma et al. Data on the prevalence of Alzheimer's disease in India is scanty. Moreover, there could be a substantial regional difference in Alzheimer's disease incidence with the heterogeneous population. The age-adjusted prevalence of Alzheimer's disease varies from 1.91% in people over 55 years of age and 3.56% in those over 65 years. Currently, available drugs for Alzheimer's disease are primarily used to improve cognitive deficits. None of the available treatments either reduce or halt the disease progression. Moreover, none can afford a cure and are largely used as palliative therapy. There is an urgent need for novel agents that have promising disease modifying potential. Further, drugs that have clinically meaningful effects on behavioral and psychological symptoms of dementia need to be developed using novel or repurposed development programs. The authors searched the site clinicaltrials.gov for clinical trials in Alzheimer's disease in the past 5 years. After applying all the relevant filters, the site yielded 44 relevant studies as per the search criteria. The various drugs classes discussed are tyrosine kinase inhibitors, anti-amyloid therapies, stem cell therapy, and miscellaneous new molecules. Discovering a new molecule and taking it to the stage of marketing is a labor-intensive, expensive, and time-consuming task with an enormous risk of failure. The drug repositioning, on the other hand, is a more fascinating, time and cost effective strategy to identify drugs for Alzheimer's disease within available approved drugs for other ailments. The rationality of this approach emanates from the fact that many such drugs are capable of targeting and manipulating important brain receptors that are intricately involved in the formation of memory, learning, and cognition and seems highly promising. This approach uses effectively repurposed FDA approved drugs. This approach is also more cost effective and recognizes several promising drugs such as quetiapine, aripiprazole, risperidone, brimonidine, betaxolol, and suvorexant. The present review provides comprehensive information on the likely future therapies for Alzheimer's disease. Many of them have disease modifying potential and few would address side symptoms of Alzheimer's disease, for example, agitation, etc. The review has tried to classify the drugs as per the target they are acting on. The review's focus is to provide the reader with a glimpse of drugs in the pipeline with relevant clinical information as necessary. The next review article which we are having is on olmesartan, with a drug with 360-degree perspectives befitting an angiotensin receptor blocker. The review article has been written by Sadanand Shetty et al. In the management of hypertension, angiotensin receptor blockers, that is ARBs, assume prime importance, being first-line agents for most patient subgroups. Olmesartan is a highly efficacious ARB that demonstrates sustained blood pressure reduction over 24 hours. Moreover, it also assumes a protective role by reducing microvascular inflammation, left ventricular hypertrophy, proteinuria, vascular stiffness, central aortic blood pressure, cardiocerebral events, and atrial fibrillation. To enhance therapeutic compliance and achieve blood pressure goals, single pill combinations with other antihypertensive agents of olmesartan are also available. This review holistically summarizes the evidence of olmesartan for hypertension management for not only blood pressure reduction but also organoprotective effects. I strongly recommend that our listeners should read this review article. Moving on to our last review article in this issue, that is on gluconephrotic syndrome, a comprehensive review by Saurabh Sharma et al. This article provides an overview of the diabetic kidney disease paradigm, explaining important aspects such as prognostic markers, clinical assessments, and therapeutic options. The importance of the term gluconephrotic syndrome is emphasized, highlighting its significant influence on clinical evaluations, research procedures, screening techniques, and patient care. This term encapsulates nephrotic syndrome within the diabetic milieu, shedding light on the intricate relationship between renal complications and diabetes. Gluconephrotic syndrome necessitates a refined approach, considering the unique challenges posed by diabetes in the context of nephrotic syndrome. With this review, we want to highlight how important it is to assess diabetes in every case of nephrotic syndrome and how important it is to assess albuminuria in every diabetic patient. This issue also includes an update article, a comprehensive review on allergic disorders, their epidemiological trend, and barriers in management by Gaurang Santra. Allergy, as we all know, is an important public health disorder. Common allergic disorders include asthma, rhinitis, conjunctivitis, atopic eczema, contact dermatitis, and food and drug allergies. In this article, allergic disorders are discussed comprehensively along with their epidemiological trends, quality of care, and barriers in management. Allergic disorders have increased in prevalence throughout the world, except for a few foci where asthma is decreasing, like Spain. Prevention of allergen exposure, pharmacotherapy, and immunotherapy are different modes of controlling allergy. Extensive training, research, and awareness can improve the quality of allergy care. With this, we come to an end of this podcast issue of JAPI December 2024 issue. Thank you all for listening to JAPI podcast and wish you a very happy new year.